Care reform aims to prevent family separation, improve care within families, provide alternative care for children who can't be cared for by parents, and support reintegration. Care reform promotes family-based care. It seeks to end the use of institutional care and provide alternatives for children who can't be cared for by parents, such as care by extended family or foster care. Care reform involves systematic change, which includes changes to policies, legislation, guidance, improving coordination mechanisms, building the social service workforce, providing alternative care services and supports to families. Children and communities play a crucial role in care reform.
The government of Rwanda decided to invest in care reform because it wanted to revive the Rwandan tradition and the cultures which promote children and the families to remain together. So it was just to transform the then child protection system into a family-based and a family strengthening, whose resources, both human and financial, are targeted to support and help vulnerable children to remain with their families.
The government officers, who are mostly, of course, Kenyans, started reflecting on how would Africa, how would communities in Kenya deal with situation where parents had died or where parents could not take care of their children. And the idea of the naturalness of kinship care came up. And it was a moment of realization, actually, children can be taken care of within families, because it had happened even before the introduction of institutions in Kenya. Because the introduction of institutions in Kenya is quite recent. It's in the 1950s.
We realized that many children who have grown up in the institutions have challenges. It impacts negatively on them, and many of them are affected either physically, emotionally, or even mentally. So the brain development is affected, as they cannot grow like the other children.
The first step was an assessment, a rapid assessment of the situation of the institutional care in Rwanda. And this was done back in 2013. And this has revealed that in Rwanda, there were more than 3,000 children in orphanages. These children with disabilities centers are not included in this figure. And some of those children were like more than 75% were having at least one parent. And this has shown that children in residential care are not necessarily orphans.
When we started care reform, there is a lot of resistance that you meet as government, because many organizations who are engaged in residential care, this is more of their lifeline. And when they get to know that you want to transition a residential care or institutional care, they get threatened and they feel that that is the end of their life. So the first thing is a move to start with engaging the relevant stakeholders in charitable children institutions, and even the donors who give them funds, because that is where even to start from, if you are able to engage them, to just explain to them why it is necessary to move to community-based care away from residential care. So awareness to all the stakeholders. There's also a need of change of attitude, where we need to have people change their attitude and even behavior, and practice a child care, a community-based care buy-in from all the stakeholders. Also, the starting point is the goodwill. You need to get the goodwill from the highest office. Like Rwanda, we realized it is the president who is pushing the agenda. So if you have the goodwill from the IFS, I told you, like in Kenya, we have that, because before we started, our cabinet secretary was involved. And every time we've had our president talk about children to move away from the institutions and to be taken care of by the families and the community. So the government has to take the lead.
Throughout the care reform implementation, we learned that any care reform succeeds when it builds on the people's culture and the customs, when it just builds on the existing traditional successes, when also there is above all the government commitment, because if there is no ownership on the government level, I think it's really difficult to have successes. Also, what I can mention is that partnership, the government can't work or could not work alone, and it can't continue working alone. You see, there is also a need of a partnership.
So the government has to take the lead, whereby the coordination of all the programs of this process has to be coordinated by the government, so that the stakeholders, especially the partners and the donors, are able to be guided on how to move.
It is not about closing institution, but rather finding better ways in which institution can convert their services from an institutional-based care support to either community support or family support care.
You have to review your laws so that you are sure where there are gaps, you have filled them, you have amended, and then this is what will now protect the children as far as the law is concerned. So all the documents, policies must be reviewed to guide the process.
Another very, very important thing I've seen is the engagement of caregivers. I saw a number of officers that were not convinced on care reform when they heard the caregivers talk about their own experience while in care and while outside those institutions, and what it has meant for them. That was a change, a change that officers took. Like, I impacted. I can tell you, I saw some officers who wrote that letter that this child is committed to an institution. I've seen some of them shed tears and regret, why did I do this to so many children? Because they didn't know. And that is very important, that some of the practices that people are doing as officers, they don't know it is bad.
You need to do a lot of borrowing from countries with best practices, and that will guide. Thank you.